Hello, you are watching Donut News in English. Bayintumansum has started implementing the Future of Development program this year. The program will provide tuition scholarships to students and government employees who are studying in deficient occupations. After graduation, they must work in some for 1 to 5 years. For the first time, 6 citizens are participating in the program. 3 of them are students and 3 are civil servants.
I am a resident of the Hottenbach of the fourth Bag of Bayintumansum. I have been working in my home since graduating as a vegetarian in 2016. While working, I heard about my home's scholarship program and submitted a request to my governor. Afterwards, the governor made a decision, and now I will be studying as a large animal vet for a year in 2023. I'm hoping to make a contrast with my governor and work in my home after graduating. My son Batchang studies veterinary in Ulaanbaatar. He is now a 5th-year university student and will be working the same job as me. He is participating in the scholarship program of Bayintumansum to come to as a large animal vet. I was very happy to sign on this. I work as a treasurer at the kindergarten of Bayintumansum. I'm happy that I will get to study at Donut University as a preschool teacher. The AMA governor and the SOM governor contrasted and worked with Melange and organizations that operates in the second bag of the Bayintumansum. Within the frame of social responsibility clause in this contract is about a project that will be carried out among the residents of Bayintumansum. This project will cost 30 million per year for 5 years. 3 students from our home are participating in the program initiated by the AMA governor. By carrying out this program in the homes and countrysides, it helps more people and fixes the problem of inadequate human resources in the countryside.
In recent years, due to the shortage of personnel in SOM, the human resources training program of SOM is planned to be implemented for 5 years by providing scholarship for tuition fees. This scholarship program is unique in that students and people working in government organizations can participate and become professionals. 1,084 cows of 177 households in 11 bag of 6 SOMs have been affected by the disease of cattle skin. Out of these, 1,077 cattle were killed and a restriction regime was established in the focal and suspicious areas. Due to this, quarantine continues in some bag of method halqal Bayindon Dashpalpar and Bolgang.
The disease first spread in the second bag of the Bayintumansum. We took measures such as repeated emergency immunizations and cullings. The spread of the diseases is decreasing in 6 homes as of now. For a while, starting from July 28th, the disease was spreading rapidly in 3 bags of Halqal. As of today, a total of 1,084 cast from 176 households in 11 blocks of the aforementioned 6 homes are to be called. All of the homes are currently under quarantine. However, according to Article 16 of the Public Health Law, we are establishing 4 zones, which are center of epidemic, suspected infection zone, protection zone, and healthy zone. 22 outposts have been set up in 6 zones. Because the incubation period of the disease is 28 days. We are performing weekly checkups. We are calling infected cattle urgently.
Last year, it was estimated that 2,400 cows infected with bovine skin plague disease would be killed and compensation of 3.2 million Mongolian would be paid. However, since the beginning of the year, 1,077 cows have been destroyed, and the compensation for these cows will be included in the next year's state budget. According to the General Department of Veterinary Medicine, the Department of Veterinary Medicine says that due to the delay in the issue of compensation, farmers do not kill their sick cattle and use medicines to disappear open wounds.
Ер нь бол мэдээж малчин хүний одоо энэ Монгол орны
In general, of course, the will of the herdsman is cattle, and cattle are self-sufficient animals. I understand the fact that not receiving compensation for one cow until now after killing the cattle is really affecting the livelihood of the herdsmen. However, firstly, not bringing up the issues of a lack of compensation. Secondly, the farmers' understanding of the dangers of this disease is very weak. In that region, our animal experts and the farmers misunderstanding each other, and the farmers not understanding the harm caused by the disease causes them to hide the disease. On their own, without the advice of a professional vet, calling each other to ask, then arbitrarily treating with the antibiotics and hiding it. Creates a high risk of spreading this disease. The law on animal health clearly states the responsibility of herdsmen clearly. First, if the animal shows any suspicious symptoms of an animal disease, the herdsman must notify the local veterinary institution within 12 hours. However, the animals we work with were infected way before 20 hours ago. The first risk of infection is arising because people are trying to hide the disease and treat it themselves. Secondly, there are several principles for fighting against infectious disease. First of all, there are guidelines for early detection of sick animals and isolation of suspected and sick animals. Depending on the disease, after that, immunization will be done. We have a strategy to eliminate the disease in a short period of time by identifying the center of the disease, restricting the movement of animals and people there, imposing quarantine, exterminated the infected animals, disinfecting the veterinary hospital, and carrying out all these measures. Well, a common violation is that farmers and people with animals hide their animals with symptoms, treat them, and combine them with other herds. What kind of damage is caused by this? For example, if 2 cows were sick, they would treat and combine them with the herd and make 20 cows sick, causing the disease to spread. When we discover this kind of situations, we hold the citizen who committed the violation responsible on the boat.
Cow lumpy skin disease is a variant of cowpox and is currently considered incurable, so it must be destroyed. The latent period of the disease is 28 days, while the virus remains in infected cattle for 6 to 7 months. So the risk of infection is high. Therefore, if the symptoms of the disease are detected, it is important to immediately go to the veterinary hospital and implement the control method according to the instructions. Research has been started on whether there are diseases caused by rusty water among the population of Chobasan and which diseases are high. At the suggestion of the Eastern Province Governor's Office and the Department of Health, a team of 6 researchers from the Institute of Medicine is conducting research on households. 200 households from Hirlansom and 200 households from Chobasan and Sarangobasam will be included in the survey.
In general, our questionnaire has a question related to the changes in the human body when consuming water with a lot of rust and iron and water with a lot of minerals. It means that there are questions to detect a related disease. Digestive, liver, cardiovascular, etc. questions.
When the test was done twice, the iron content was higher than it should be. Therefore, it is planned to identify water-related diseases among the population and take countermeasures against them. In connection with the beginning of the flu-like disease season, the Department of Health advises spreading awareness of the disease of influenza and preventing the disease and coping with less illness. Influenza is an airborne respiratory disease caused by a virus. Because the disease can easily become serious and can infect many people, it is advised to start using methods to prevent the flu.
What measures should parents take during this epidemic? If your child has a fever, make them drink warm liquids and eat hot vitamin-rich food, and then it is much more effective to see a doctor and take medicine as they instruct. Prevention is very important. In order not to get a disease, there are two types of prevention, specific and non-specific. Simple non-specific prevention methods include washing your hands, wearing a mask, moisturizing and disinfecting yourself, going through public places as little as possible, wearing a mask if you go, and wearing warm clothes because it is starting to get cold. The specific prevention method is the flu vaccine. We have been administering the 3-cent and 4-cent flu vaccine since September 2nd. On a voluntary basis, people of all ages over 6 months can get the flu shot.
The latent period of the flu lasts 1 to 5 days, while the infectious period lasts up to 10 days. Therefore, if you have flu symptoms or are sick, it is recommended to wear masks, keep your distance, and stay at home to avoid spreading the infections to others. The goal is to improve the English language level of elementary school students studying in Som, a remote province of Mongolia, and to make the progress in their learning. As part of this project, Mongolians living in England collected English books and sent to 31,000 books to Mongolia. In the project, the family of Borbater Bolorma, a 1966 graduate of the first school held in Som Donut province, together with his friends, collected more than 1,000 books and 20 DVDs and sent to the central library of the province. Starting from 2017, Donut province has been implementing the work of reducing the burden of second-level hospitals and reducing the difficulties faced by the citizens, empowering the primary health centers and providing them with equipment. This year, equipment worth 100 million Mongolian Turk was supplied to some and health centers.
Every year for the last 5 years and for the total of 170 million Turks each year. Each health center is renovated with 10 million Turks. So we are taking all measures to avoid problems at the primary level caused by some equipments. We are working to make it so that people can go to the local family health center or the home health center to be tested, receive treatment, have equipment such as tables to warm up their babies. Furthermore, we plan to supply school and kindergarten physicians with equipment, and if we have good medical equipment and personnel at the initial stage, the burden and the number of visits to the hospital will be significantly reduced. Family health centers, which are primary health care institutions, lacked essential equipment 5 years ago. In this context, when the quality of healthcare service test was conducted for the accreditation of health institutions, it was concluded that there was a lack of equipment supply. The governor of the province proposed this initiative to the meeting of the citizens of the province, and since then the equipment has been supplied in phases over 5 years. The supply of equipment has increased by approximately 50%. Here we aim to provide more essential equipment such as laboratory equipment, rehabilitation equipment, and emergency equipment.
Since the implementation of the program, more than 850 million Mongolian tenge worth of equipment has been supplied to primary health centers. In this way, citizens are receiving various types of healthcare services without having to go to the donor medical centers. On the other hand, the local government is independently implementing targeted projects aimed at improving the stable working conditions and improving the skills of doctors and nurses working there. His name is Batu Guldur. It has been a year since he established the Eastern Guitar Training Center. During this period, more than 500 people between the ages of 5 and 50 were given basic and advanced music education in the ukulele and guitar. The children and young who participated in the training make performance.
Hello, how are you all today? Our guitar training center's last concert of the year is taking place now. The first concert was held on April 2nd and the second concert was held on September 10th. In general, in our Donut Guitar Training Center plans to hold concerts twice a year. Our last play of the year is coming to an end. In total, more than 50 children participated in this concert and put in everything they learned. I'm also very happy that our band Usik Iredu came to perform today. I'm also happy that Eke Food, Chicken and Jarran TV are working as our sponsor.
Every autumn, potato, vegetable, and dairy fairs are organized to bring local products and newly harvested vegetables to customers in one place. More than 80 private enterprises from 10 summers participated in this year's Golden Autumn Fair and sold 20 million Mongolian tenge on the first day.
In the future, by implementing a greenhouse project and vault projects to increase vegetable production, and by implementing the construction of vegetable wallet, we are setting a goal to increase the supply of vegetables to 50% within 5 years.
This day is a holiday for cultural workers. On the occasion of the 29th anniversary of this day, the Museum of Eastern Province, together with Dashbalbarsam Cultural Center, has opened an exhibition of Mongolian beautiful paintings by folk artist, honored artist of Mongolia, Oton Gelik.
Today's event is a very important event for us. We are presenting Beauty of Mongolia, a piece by state award-winning folk artist Gelik, one of the most famous artists of Dornodemok. This is a very important thing. When a child takes up painting more than becoming a famous artist, he will be able to pass on a message of great understanding and education to society as a whole through painting. Therefore, I would like to express my science gratuity to our Amox Museum staff and Dashbalbers Homes Cultural Center staff who organized today's event, Chadek, who designed our national flag, and Atongo, who painted after work, are also from our Amok. There are great works of art that will never lose their value even after 10 years have passed, such as freeing Nislil Hure. We should be proud of them. Therefore, I encourage children to take up painting, and from next year, the province government will provide housing, teachers, etc. Let's pray that many famous artists will be born from Dornodemok.
From the time he started creating his art to the end, About 40 works such as canvas, oil, watercolor, and stripes are presented to the public. Thus, cultural organizations will continuously organize activities to promote cultural and provide cultural knowledge to the public on this day every year. There are 1,130 doctors and medical specialists working in the health sector of the Eastern Province. 26.5% of them, or 300, are nurses. Job turnover is high due to the high number of patients per nurse and low pay. Therefore, to support the sustainable employment of nurses and the social guarantee of skills, the iNurse project competition was initiated by Donut Province for the first time.
I organized an event, Let's Protect Our Eyes, as a project. Also, I hope that our children keep their eyes healthy from childhood and have sharp eyesight. I have chosen the theme that a healthy family will give birth to a healthy child. In general, I believe that my skills have improved. I have never participated in such a competition before. The first time I participated in such a competition, I won by improving my skills. I took part in the contest organized by the initiative of the governor called I'm a Nurse. By participating, I helped bring attention to the value of nurses and helped work stability. This project contest was organized into 3 stages. The first was the phase of our material preparations research. The second was vocational skills and theoretical knowledge skill. The third one was organized according to 5 criteria. The 5 criteria were showing the public nursing care, social care service for those in need, new proposals for humanitarian care and nursing care service.
This project, which is a real investment in the lives of nurses, will be held as a tradition every year. Thank you for watching Donut News in English.